Hi, everyone, and welcome to this week's episode of Understanding Finance. Thank you for joining us. I'm Brian Bedford. I'm an accredited investment fiduciary, a chartered financial consultant, and a chartered advisor for senior living. What all that means is I've spent a lot of time studying to make sure that I can help my clients and retirees provide the best retirement they can financially. This week with me, I've got David Carodi. David is a licensed healthcare specialist, and he is our healthcare specialist here with Legacy Financial Insurance Services. And last week, David and Tammy had a conversation about Medicare, and it started our series on Medicare, and it really was looking from 10,000 feet down. And it talked about what is Medicare and how do you enroll. So David, if you could just take a minute and recap a little bit of last week, and then we'll dig into this week.
Sure.
Thank you.
Last week we talked about the public portion of Medicare, which is Part A and Part B. Part A is your hospitalization coverage, and Part B is your medical coverage, also known as doctors and procedures. And together they provide you with your medical coverage under Medicare. The issue with it is, though, they have huge gaps in the coverage, things that aren't covered and things that are covered with huge deductibles and copays. And those are there by design, because this Part A and Part B is set up specifically designed to work with a private insurance partner, and together you get comprehensive health care. For instance, Part B, which is your doctors and procedures, under the public portion of Medicare, pays 80% and you pay 20%. If you have a hospital stay, everything, your hospital bed is covered under Part A, but everything else in that hospital is covered under Part B, more or less. That can be a tremendous amount at 20%. So your supplemental insurance, your private portion of it, is designed to fill that gap. One thing to know is when you turn 65, Medicare becomes your primary health insurance provider for the rest of your life, unless you continue to work or your spouse continues to work and you're covered on an employer group health plan that covers 20 or more employees. If that specific caveat is not you, Medicare is primary for the rest of your life. So you've got these big gaps in Part A and Part B that we discussed last week, and you have different options on how you fill those gaps.
And that's where we start today's conversation, because today we're going to dig a little deeper. We're going to dig into that private side of insurance, and we're going to discuss specifically the Medigap plans, the Medicare managed care plans, as well as the retiree benefits, or the retiree health benefits, retirement benefits. So if you could start, let's start probably with the retirement coverage or retiree coverage, and we'll go from there. But just talk a little bit about what retiree coverage is as it compares maybe to what we had when we were working, and then maybe some advantages and disadvantages.
Well, retiree coverage is just what it is. If you retire from your employer, let's say you retire before age 65, and you're fortunate enough to have your health plan bridged for you as part of a retirement arrangement to cover you to age 65 when you're eligible for Medicare, that's retiree coverage. In some cases, you can use it as the supplemental coverage to Medicare if it's offered as a benefit, and that will be, instead of say a Medigap or a Medicare Advantage plan, that will be your secondary insurance. Also, if you continue to work after age 65, you can defer Medicare. You may want to sign up for Part A because it's free, but defer Part B as long as your employer group health plan that you or your spouse is on covers 20 or more employees. You can defer that till you go off that plan and then sign up for Medicare. It's becoming less and less common to see somebody have retiree coverage, especially, and then you also need to make sure that the coverage that you do have is considered creditable, which means it's at least as good as what you could get from Medicare. Because if it's not, and you don't sign up for Medicare, you can pay a penalty, and that penalty on your public portion of Medicare, Part B, could last you for the rest of your life.
Okay.
So that's one option. It's becoming less and less common.
Right.
Most people are in a Medigap or a Medicare Advantage situation, but for those fortunate enough to have that coverage, it can be that in place.
Right.
In its place.
Well, it's a great option, it sounds like, for those who have it available. But that'll lead us on to what a lot of people don't. So let's talk about the Medigap plans next. And with the Medigap plans, again, describe what a Medigap plan is. Its name kind of tells you something. And then advantages and disadvantages.
Well, a Medigap plan is exactly what it says. It is a policy that pays certain costs that Medicare doesn't cover. So for instance, your hospitalization deductible, it pays that. Your 20%, it's not covered on Part B. It's designed to pay that. Specifically, what it doesn't cover is prescription drugs. If you choose a Medigap option, and there are advantages to choosing that, you have to buy a standalone prescription drug plan, even if you don't take prescription drugs, because nobody wants to be without prescription drugs. You never know when you'll have something pop up in your health and you'll need a drug, and if it's a very expensive drug, it could be a disaster. So, Medigap coverages follows federal and state guidelines. That means the coverages are set, they can't be deviated from. You buy your coverage in a column of coverages based on the letter of the alphabet from A to N.
Okay.
In the past,
That's a lot.
the most popular plan was always Plan F. Plan F was comprehensive coverage. It covered all the gaps in Part A and B in full for a premium, and that and a prescription drug plan and Part A and B gave you pretty much locked down major medical insurance. Good anywhere in the United States that accepts Medicare. It doesn't cross state borders, so you don't have to live in the network. You can go anywhere and get your coverage. And it has a guaranteed issue period.
What's that mean?
Well, when you turn 65 and you sign up for Part B, you open up a 6-month window. It doesn't matter what your health is. It doesn't matter if you're sick. It doesn't matter if, whatever the reason.
No pre-existing condition or anything like that can be.
You have a 6-month time period where they have to take you, and that's in all states. In New York, we don't have guaranteed issue periods. They don't allow them. But in most states, they do. And that's something you want to be cognizant of if you're going to move to another state. So for instance...
So does that mean in New York that because we don't have guaranteed issue that they don't have to take us, or that they always have to take us?
They always have to take you.
Perfect.
So most of the laws you'll find in New York State that can be subjective will fall to the benefit of the member
The insurance
instead of to the insurance company, and that's to our benefit. There's a lot of reasons people don't like to live in New York, but one of the reasons that you would like to live is when you start to review these things, and you do my job. So, guaranteed issue period in a nutshell. You sign up for Part B, you're a resident of a state that has a guaranteed issue period deadline, and then you don't get a Medigap plan and that 6-month window expires, you may never get one. You may be shoehorned into a Medicare Advantage plan, whether you want one or not. In New York, that's not the case. There's 3 other states, Connecticut, 2 others, I don't off the top of my head know, but it's something you want to be aware of. If that's your plan is to retire and move, it's something you should sit down with your healthcare advisor, somebody like myself, and you need to bring that point up so that you can address that point and make the right decision for yourself. So
while you're in a state that doesn't have the...
Well, while you're in that window.
Right.
Because you can always leave Medigap at some point during your annual election period and go to a Medicare Advantage plan, but you may not be able to go the other way. And it's something just you want to think about and have at the top of your mind so that you've addressed that to a situation that you're comfortable with.
Okay, so we got A through N.
A through N plans, you're shopping based on price, and the insurance company...
Just on price?
Well, you may be most comfortable with the insurance company that you had through your career as on your employer group health plan. Their premium may be a little bit higher, but you're comfortable with the way that company does business. They have an excellent reputation and they have a very deep network.
Yeah.
You may want to buy your plan from them, even though you can go anywhere that accepts Medicare and pay that premium. But in most cases, people shop it by price.
Okay, because every plan letter is government mandated what it is, so it has to be the same, right?
They all have the same coverages.
Yep.
You have certain responsibilities. For instance, in Plan G, which is the new plan, because people born who turn 65 after January 1st, 2020 can no longer have a Plan F. They would take, if they wanted the all-the-way coverage, they would have to take a Plan G. The difference between F and G is, in a Plan G, you have to pay your once-a-year Part B deductible, which this year was $198. Before that, you get a lower premium.
Right.
And if you were born and turned 65 before 2020, a Plan F will always be available for you.
Okay.
So,
great. All right, so we've got retiree coverage plans covered. We've got Medigap coverage covered. Let's move on to the managed care. It sounds complicated.
It's not. Medicare Advantage plans are similar to the group health insurance plans you had when you or your spouse was working and providing coverage for your family. They have things, they focus on wellness, coordination of care. They have co-pays and deductibles, and they almost always include prescription drug plans, so you do not have to go and buy a separate prescription drug plan.
Okay.
In this area, there are 24 Medicare Advantage plans available from different companies. Most companies have more than one option, and they have different premiums. You can either, if you're very, very healthy at age 65, you could take a premium as low as zero.
Zero.
But the costs, being known in advance that the costs of that plan are inside the plan in co-pays and deductibles.
Makes sense.
But if you're very healthy, that may be the plan for you for the foreseeable future. And as your health changes or the plan changes, that's what the annual election period is for each year. You go in and you find the plan that best suits you for the coming year. Try and remember, these are one-year contracts. You have the option to change every single year because the plan has the option to submit changes to their plan for you for the following year. It's your responsibility to review that plan, make sure it still suits you, or meet with somebody like me and have me help you.
So if the plan can submit changes to the plan that you're already signed up for, even if you didn't plan to make any changes, you've had no change in your health, you have no change in your meds, but that plan that you're on can make changes to their plan, so you really have to take a solid look every single year.
It's in your best interest. There's two reasons. Your health may change, the plan may change. It's very easy to end up with a plan that suited you perfectly at age 65. At age 70, it's the wrong plan. And I see it all the time. They think this plan is for the rest of their life, and that is not the case. You should be reviewing this every year to find the plan that's best for you. Remember, in order to have a Medicare Advantage plan, you gotta have Part A and you gotta have Part B. You're gonna have co-pays, you're gonna have deductibles. You're gonna have a maximum out-of-pocket of $6,700 a year, not including drugs. So you're operating in that window.
Right.
People find often they are very comfortable with it. It's what they're most used to.
It's a lot like what we have when we're working.
Correct. And in this area of the United States, in Western New York specifically, a quick fact. Medigap plans cover about 70% nationwide of people who are on Medicare. But in this area, about 70% of the people are on Medicare Advantage plans.
Really?
That speaks to the density of the plans, how big the networks are, how good they are. They're very good at making money. And it's what most of us in our career have become accustomed to working with. We know the ins and outs.
Right. If I can keep the same insurance that I've had my entire working life into my retirement, and it's not an overwhelming price, I'm going to be really comfortable with that.
Sure. And you're going to get paperwork, you're going to get bills. Whereas a Medigap plan, it's kind of a cut and dried contract. Medicare pays their end, Medigap plan pays the rest. If you have full coverage in that, you're not going to get a bill. This plan, you can get bills, you can save money. More importantly, they're allowed to offer ancillary benefits, such as
vision and stuff.
Vision and dental, hearing. So if you're 65 and you have a hearing aid in your near future, you're going to want to shop for a plan that has very good hearing coverage. Remember, it's a one-year contract, and that's something if it's important to you or some other specific coverage that they offer you. These plans also have developed into the downside of a Medicare Advantage plan often is you have to get your care in the network. Just like with your work plan.
Right.
You leave the network, you're going to pay a higher cost because you're out of network, which didn't always suit people who snow burn it in the wintertime.
Yeah, I was just going to ask you, so what happens if I want to go and spend 3 months in Florida? And
Emergency coverage is always provided on both, either way, Medigap or Medicare Advantage.
Okay.
But some Medicare Advantage plans offer a passport type program where you can contact them and tell them, I'm going to Florida for 4 months and I will be in this city. And they will tell you, okay, when you're there, this is going to be your GP and this is your group and your network. And you can get your care there and it will be in network. Notify us when you return and when you come back. So now you have in-network prices both. And it helps Medicare Advantage plans better compete with Medigap plans. And it's part of the reason that there's such a growth in people moving to the Medicare Advantage plans from Medigap. The ancillary benefits, the somewhat portability of it, and cost. If you're healthy at age 65 and you can have 0 premium, sure, you have to pay your co-pays for your drugs, and you have to pay to see your doctor, and you have to pay your Part B premium, but you can have very, very manageable costs for your health care in the years after you retire when you're most healthy.
And I'm gonna have vision and dental and all that stuff too.
And that money then will be available. If you look at retirement health care as a bucket of money that's to last your life,
Right.
like you and Tammy do, you leave more money in that bucket for years later in your life when you're going to use your health care a lot more.
Right, because then I can switch over to the Medigap plan, be comfortable paying a little bit higher premium or a lot higher premium, whatever it might be.
A different Medicare Advantage plan that may have a higher premium, but the coverages inside are denser and the co-pays are lower.
I'll tell you what, the importance of this Medicare planning is becoming more and more clear to, I think, all of us. And the work that you do specifically is so important because the average person is not going to want to dig through all this stuff on their own. Is my medication covered under this plan, this plan, this plan, this plan? I'm assuming you have software that you can use that
Certainly.
you can type this stuff in and it's going to spit out, yes, it's covered, no, it's not, go to this one.
You have to be it's a weird time in life to have to learn this, because starting at age 65, if you go on Medicare, you are your own best advocate. You are in charge of your health care.
Yeah.
And it's something that's new to most of us. It can be very confusing. It's created a great job for me. I enjoy the work tremendously, and it's great to help people. It's not as hard as it may sound to get your brain around this and start understanding it and looking forward to the annual election period and seeing what the options are and making a decision. It's not tremendously time consuming, but there's a lot of peace of mind in knowing you've made the best choice for yourself.
Yeah, makes a lot of sense to me. So I know, I've had a number of clients that have utilized your services already, and they're all thrilled just at the whole process, the time savings, and the fact that they sleep at night knowing that they've made the right choices. So kudos to you on that. We really appreciate that effort, and that's why we brought you aboard. So that's working out well. Thank you. And I think, we're kind of wrapping up our conversation today. The only thing we have left to do really is remind people to watch next week, next Thursday, 11 o'clock on July 16th. We're going to move on to the next topic. We're going to get a little bit farther down the road into the Medicare planning, and we're going to talk about what your financial plan, how that affects your Medicare plan. And we're also going to talk about what your Medicare planning doesn't cover and how to build financial planning around it. So we really look forward to you joining us next week, Thursday, July 16th at 11. Please tune in. If you didn't have an opportunity to watch last week's episode, please go to our website or go to our YouTube channel. You go to YouTube, type in Legacy Financial Planning, and it will come right up. Or you just go to our website, go under webinars, hit the link. It'll be right there for you as well. And we are going to put this one there as well. So each week we're going to continue to do these webinars to try to continue our education concept with Legacy that we've always had. It's different in that we're no longer in front of the room, but we're in front of the camera. So we will continue for as long as this goes like this, and we may even continue doing it after. So thank you for tuning in today. Please go to that YouTube channel and subscribe. Please go to our Facebook page and follow us on Facebook, because a lot of information is released via Facebook about our upcoming events. And have a great day. Stay safe, everybody.
If you have any questions that I brought, if this has created any questions for you, please feel free to contact me. I'm here at the office at 585-241-5250, or email at david@legacyfp.com.
Thanks, Dave.
Brian.
We really appreciate it.
Take care.